When we compare robot against open surgery, obviously robot is better because robot is a minimally invasive operation. We're talking about shorter hospital stay, less pain, better healing, and less wound complications.
As a surgeon, I am the one that controlling the camera. In traditional surgery, the assistant will be the one that controlling the camera, and it may not reach the field or the angle that I want it to be. But in robotic surgery, I'm in control of the camera with a 3D magnified view, and also our hands are actually controlling the instruments to dissect, to cut, or to join back. So for the robotic system, basically there are three components. One, we call it the surgeon console. So basically we sit on the console and we control the robotic arm. The second component is patient's cart, which consists of the 4 robotic arms that we insert through patient's abdomen and also where we insert the necessary surgical instrument to perform the surgery. The third component is called the vision cart, where it incorporates energy device for us to stop bleeding or for us to cut patient's organ or tissue, and also it integrates the surgeon console to patient's cart for us to perform the surgery together. Although it is called robotic surgery, but the surgery is actually still being done by the surgeon.
When we apply a robotic platform onto the patient, the steps to start are almost identical to start a traditional laparoscopy. We make keyholes on the abdomen to put in the access ports. Once the access ports are in, we inflate the tummy and blow it up with air. It creates a space. Now from there on, things change between laparoscopy and robot. Now the robot comes in, the 4 arms go through the access ports, and I will go to the console and start to control the robot to do the operation. Just like any other laparoscopy system, we can turn the camera to the different degrees to look at different angles, just like how I do this. So I don't need to really turn my body, I can turn my head.
I recently have a case of a patient who came with very bad reflux disease, heartburn. The patient was diagnosed with a hiatal hernia, and the patient was also obese based on the high BMI with underlying metabolic syndromes. Post-operatively, patient could tell that the pain was not much. We finished the operation in the morning and patient started walking around in the evening. Patient was discharged well home on the post-operative day 2. Upon follow-up, patient has made a good recovery and the scars or the wounds have healed well with no complications.
The first robotic surgery to be done in this hospital. It is an 89 years old patient. It was a major operation. She had a part of a sigmoid colon and also the rectum removed. Right? It took quite a bit of time, and she went home at day 5. The joint was in perfect condition. Her passing motion is just nice with no incontinence. I feel that it is a brilliant success for a first case.